Paragon trial, Dr. Amir Anwar from Cairo University.
Sabah al-Khair, my dear professors and colleagues, it's my pleasure to be presenting today. My talk will be about Paragon heart failure trial with a specific focus on analysis of the patients with hypertension in this trial. Paragon heart failure trial was published in 2019, and the main question of the study was to test sacubitril valsartan versus valsartan in treatment of patients with heart failure with preserved ejection fraction. Paragon heart failure was a randomized, double-blinded trial, active comparator trial. Active comparator means that they tested sacubitril valsartan not against a placebo, but against an active medication, which was valsartan in this trial. In Paragon heart failure, the inclusion criteria were patients above 50 years of age with ejection fraction above 45%, with symptoms of heart failure and evidence of structural heart disease, either left atrial enlargement or left ventricular hypertrophy. And patients had to have one of the following, either recent hospitalization for heart failure or elevated pro-terminal natriuretic peptide. This was the design of the trial. Patients with HFpEF, about 4,822 patients. At the beginning, they had a run-in phase where all the patients received valsartan 80 milligram twice daily for 1 to 2 weeks. And following that, all the patients received sacubitril valsartan 100 milligram twice daily for 3 to 4 weeks. And after the run-in period, all the patients were randomized into 2 groups. The first group received sacubitril valsartan in the maximal dose, 200 milligram twice daily, versus valsartan in the target dose, 160 milligram twice daily. The primary outcome in Paragon heart failure was a composite outcome of total hospitalizations for heart failure and death from cardiovascular causes, and the median follow-up was 35 months. These were the results. Actually, there was a trend towards some fewer hospitalizations in the arm of sacubitril valsartan. There was no difference in the cardiovascular mortality, and overall, there was no difference between 2 groups in the composite endpoint of cardiovascular death and total heart failure hospitalization. Paragon heart failure trial was a negative one, as there was no effect, there was no difference in the effect between sacubitril valsartan and valsartan in patients with HFpEF. Regarding the safety profile, patients on sacubitril valsartan experienced more hypotension and more angioedema. And on the contrary, patients on valsartan had higher rates of increased serum creatinine and hyperkalemia as compared to sacubitril valsartan. Okay, then when they looked specifically for patients with hypertension in the Paragon heart failure trial, it was found that more than 95% of the patients enrolled in this trial were hypertensive. And when they compared the systolic blood pressure in both groups, in patients receiving sacubitril valsartan versus patients receiving valsartan, as we can see in the graph, patients on sacubitril valsartan achieved significantly lowered systolic blood pressure as compared to those on valsartan. 2 years later, in 2021, there was a post hoc analysis of the Paragon heart failure trial, and they looked specifically for patients with resistant hypertension in the Paragon heart failure trial. As we know, post hoc analysis mean that this analysis was not pre-planned, was not intended at the beginning and at the initial design of the study. Okay, they defined two groups of resistant hypertension. The first group they called apparent resistant hypertension, and they defined it as systolic blood pressure above the one in red, systolic blood pressure above 140 or 135 millimeter mercury in diabetic patients, provided that the patient is taking valsartan, calcium channel blocker, and diuretic. And this group of apparent resistant hypertension represented about 15.2% of all the group in Paragon heart failure. And another group of resistant hypertension, they called it mineralocorticoid receptor antagonist resistant hypertension. They defined it as systolic blood pressure above 140 or 135 if the patient is diabetic, provided the patient is taking valsartan, calcium channel blocker, diuretic, and MRA. And patients with MRA-resistant hypertension in this trial represented about 2.8% of all the enrolled patients. Over the course of the trial, they compared the cardiovascular outcomes of patients with apparent resistant hypertension against patients with controlled hypertension. And here, patients with resistant hypertension, it's the green line above. And as we can see, all the cardiovascular outcomes were higher in patients with apparent resistant hypertension. And I think this was expected. However, محتاج حضراتكم يعني let's focus on this graph. In this graph, they compared the systolic blood pressure reduction on sacubitril valsartan versus valsartan alone in patients with apparent resistant hypertension. The graph on the left represents patients with apparent resistant hypertension, and on the right, it's apparent MRA-resistant hypertension. لو حضراتكم فاكرين احنا قلنا ان هو in the first 2 weeks of the trial they had a run-in phase of valsartan 80 milligram twice daily, and then all the patients received sacubitril valsartan 100 milligram twice daily, and then the randomization started at 0. So the first 2 weeks, all the patients were on sacubitril valsartan 100 milligram twice daily, and then at 0 started the randomization, and over 16 weeks they followed 2 groups. And in both groups of resistant hypertension, patients on sacubitril valsartan achieved significantly lower values of systolic blood pressure as compared to patients on valsartan alone. However, this post-hoc analysis had significant limitations. First of all, because it was post-hoc analysis and it was not in the design of the trial from the beginning, so they did not use ambulatory blood pressure monitoring or out-of-office measurements to decide whether the patient was truly resistant hypertensive or not. And there was no information on treatment adherence, and there was no data about the doses of other antihypertensive medications and whether they reached the maximal doses of other classes or not. So I come to the conclusions of the Paragon heart failure trial. As we have seen, it was a negative trial. No difference between sacubitril valsartan and valsartan alone in management of patients of heart failure with preserved ejection fraction. However, in this post-hoc analysis, sacubitril valsartan was suggested to be more effective in management of patients with apparent resistant hypertension and in patients with MRA resistant hypertension. Thank you.
شكرا يا أمير. Very good talk الحقيقة. أنا عايز حضرتك بس تقول لي باختصار في كلمة، هل معنى كلام حضرتك إن resistant hypertension أنا ممكن أديله هذه المجموعة اللي هي ساكوبترين مع الفالسartan as a treatment؟
Okay.
يعني هل حضرتك الستاديز دي أكدت إن this type of drugs can lead to success as الدراجز اللي احنا عارفينها مع الادنج of mineralocorticoids؟
Okay, thank you طبعا. This is very important question. لكن we cannot derive solid conclusion from post-hoc analysis because this was not randomized the trial. This is just analysis after they got the data. The patients were not randomized. The patients were not sure they were resistant or not. وبالتالي in post-hoc analysis we derive just theory-making ideas or ideas for future research. Here they suggested that sacubitril valsartan may be an effective treatment in the management of resistant hypertension, but we cannot drive conclusions. So of course, we cannot say that we can use sacubitril valsartan as a treatment for resistant hypertension, but we can make this is for future studies.
Thank you so much for the elegant presentation, dear. I think that, as you said, this was the post hoc analysis, so we cannot rely on this data. But I believe, as long as I know, that there is an ongoing, more than one trial directing the sacubitril valsartan towards treating hypertension, even without heart failure, especially the resistant hypertension, because of the cost. These trials did start as the start of the paradigm trial for the heart failure. But again, the cost was the main barrier of this ongoing trial, or increasing the number of patients. But with the increased burden of hypertension and hypertensive heart failure patients, these trials were revived again. I think we will, in 1 or 2 years, we will have 2 major trials with the ARNI directed towards resistant hypertension.
Yes. Thank you.